insemination. Before I start, I'd like to tell you why I choose this topic. It's not because I'm infertile, I hope that I'm not, but my father is gynecologist and he's doing this artificial insemination, so it seems to me that he could help me a lot with it, but actually wasn't as great idea as I expected, but doesn't matter. So, the reason why doctors started to studying the possibility of artificial insemination was clear, because the number of human infertility, the people that cannot have a baby, is increasing, and it's increasing a lot. And nowadays we've got about 50% of pairs that cannot have a baby. Here on a small graph you can see prime causes of infertility. You can see that the main number is of unexplained infertility, which it sounds quite mysterious, but that's it. Then sperm problem, ovulatory failure, 18%. For a little bit of history, the first test tube baby child was born in 1978 in England. Only 4 years later, the same thing happened in Czech Republic in 1982, thanks to Dr. Ladislav Pilka. You can see him here on this picture. He's now 80 years old man. At his price, we've got about 4,000 test tube babies born per year here in Czech Republic. Maybe thanks to him, we are one of the best place to go through the assisted reproduction. A lot of people from another countries, for example from Germany or Austria, are coming there to have assisted reproduction here in Czech Republic. We've got two basic methods of assisted reproduction. The first one, comparatively easier one, is intrauterine insemination, IUI. That's intracorporal fertilization inside the body of woman, inside the woman's body. And the second one is so-called in vitro fertilization, IVF. That's fertilization of oocytes outside of woman's body. Both of them are always followed by hormonal therapy. So I'll tell you something about the hormonal therapy. Hormonal therapy is always made with some medicaments that regulate menstruation and ovulation cycle of women. That means that the medicaments stimulate hypophysis to produce more women's hormone like prolactin, luteinizing hormone, oxytocin, and so on. But if there's a problem that a woman cannot use these medicaments, there's the second possibility how to sort this problem out. Of direct stimulation of ovaries to produce estrogen with FSH hormone, like is follicle stimulating hormone. There are two ways how to do that. The first one is injection straight to the abdomen of woman, and the second one is to use an infusion pump that deserves a small amount of hormone straight to the woman's body. Now for the method, the easier one, intrauterine insemination, IUI, is, as I said, intracorporal fertilization. The oocytes are fertilized inside of the body of woman. It's made when washed sperm is ejected to the uterus, to place where the oocytes are fertilized, that ensure high concentration of sperm in the place where we need it. Hormonal therapy is needed there to increase the number of oocytes that can be fertilized. It's absolutely painless method. Here on the picture you can see how sperm is injected to the uterus, and here in an oviduct the fertilization is made. The second one, in vitro fertilization, the difficult one, is extracorporal fertilization, IVF. It's the fertilization of ovaries is made outside of the woman's body. This fertilization is used in many cases of human infertility. For example, damaged oviduct, men's infertility, missing oocytes, or unexplained sterility. Of course, the hormonal therapy is needed there as well, and it's hormonal therapy in 4 stages. Hormonal preparation, collection of gametes, fertilization, and cultivation of embryos and embryo transfer. The whole process, its fertilization, is made in a laboratory. It's made in a laboratory by adding sperm to cultivation media medium near to oocyte, or the second possibility how to do that is called intracytoplasmatic sperm injection, ICSI. That quality sperm is injected with some pipette or something like that straight to the cytoplasm of oocyte. Then in about 3 or 4 days, the fertilized oocyte is changing to the embryo, still outside of the woman, still in the laboratory, and then in maximum of 3 embryos it's transferred to woman's body. The rest of embryos can be frozen for next cycle. Now I'll show you a short video of ICSI method, intracytoplasmatic sperm injection.
Month. During this time, and under the influence of the body's own natural hormones, a tiny sac within the ovary containing an egg grows to about the size of a grape. At a point midway in the cycle, this egg is released from the ovary and ovulation occurs. Ovulation is also regulated by hormones. The egg, which from this moment on is ready for fertilization, then passes into the uterine tubes to await the arrival of fertile sperm. Ovulation is a naturally occurring event, and the desire to have children is a similarly natural instinct. But that instinct cannot always be fulfilled. The causes of unwanted childlessness are numerous, but so are the means of treating them. A further development of IVF is the technique of intracytoplasmic sperm injection, or ICSI for short. This is a method which has revolutionized the treatment of male infertility in recent years and gives men with poor quality sperm the chance of fathering their own children. In natural conception, many millions of sperm cells in each ejaculation are necessary for fertilization. In ICSI, just one may be enough. Women having ICSI are given special reproductive hormones to encourage several eggs to develop in the ovaries. The eggs are then removed from the ovary in a short outpatient procedure. Fertilization in ICSI is achieved by injecting an individual sperm cell into each of the collected eggs. For this purpose, each egg is placed under a very powerful microscope, and a single sperm cell is injected directly into it by means of a very fine needle. Following injection, and after about 24 hours in the incubator, most of the eggs will show signs of fertilization, and the cells divide and multiply to form an embryo. After 2 or 3 days, a healthy embryo will comprise around 8 cells. It is then transferred to the uterus by means of a thin flexible needle, where it is left to implant and form a pregnancy. All these methods of assisted reproduction offer couples a good chance of bringing a healthy baby into the world. A consultation and thorough examination are necessary for each individual patient for finding the most appropriate treatment with the highest chance of success. Because female fertility decreases quite quickly after the age of 35, infertile couples should not delay seeking appropriate medical advice.
And if anyone is interested in the prices, so the whole process costs in about 80,000 Czech crowns. But in Czech Republic it's mostly paid by health insurance companies, so if you decide to have a baby and for some reason you are not able to have it, so you would pay in about 20,000 Czech crowns. And that's all. Thank you for your attention. Now if you have some questions you can ask me.
Mm-hmm. So first of all, do you have any questions?